This is Barberton City Councils. We'll go right into our committee meetings. First committee up is Streets, Sidewalks, and Lighting with Mr. Greer.
Thank you, Mr. President. Just ask for like 30 more seconds just to make sure the stream's up and
No
going.
problem. First committee up.
All right. It looks like it's up. All right. Like to bring to order Street, Sidewalk, and Lighting. Today is January 19th, 2021. It is 6:06 p.m. and we are virtual. All committee members are present. Other council members and guests noted and documented by the clerk. Today we have 3 requests for legislation. First request for legislation is a draft ordinance titled Enter into Contract with ODOT. Mr. Tracy's not here to really speak on this right now, but looking at the verbiage, I don't have the contract, but this happened with 5th Street, as we recall earlier this year, where the city had to enter into contract with ODOT so that they can begin the process. It's kind of like handing over the project to ODOT. With a little exception, and this is just me looking at it because one of our other resolutions here has GPD for the design. So last time for the Worcester Road project, 619 project in Worcester Road, I believe that the design was done through ODOT as well. So this stretch of road that they're looking at is, pardon me if I have that here, is a resolution authorizing the mayor to enter into contract with the Ohio Department of Transportation for the improvement of Worcester Road West from Hudson Run Road to 3rd Street Northwest, also known as Project ID 108240. They are asking for an emergency. Just for quick reference of what stretch of road this is Worcester Road that runs from Durbin's Magic Freeze, and it goes all the way to the post office or vice versa from the post office downtown to Magic Freeze, and again, that's Worcester Road area. I did have some questions, but the project will include full depth repavement reconstruction, new traffic signals, pedestrian crosswalks, and sewer improvements. Mr. Tracy's not here. Do we have anybody else that might be able to? Is the mayor?
Councilman Greer, I can answer questions.
Awesome. Thank you, sir. All right. So my first question for this is just relating to the new locations for traffic signals that's listed out in the ordinance. Is that just replacing existing locations, like with new equipment?
Yes. I believe that they're taking a hard look at the light at 19th Street.
This
and they've also
will
looked
now
at,
be recorded.
They've also looked at the intersection at 16th Street, which to the south runs into several different businesses and PPG. But this is a major project. And the entering into contract, we have to do this for all AMATS awarded projects because ODOT runs them. So every single one, even though it's already been approved, we still have to enter into contract.
And with this being AMATS, is this a typical 80-20?
Yes.
I'm on now, by the way.
Oh, okay. Awesome. Thank you.
It is 80-20 for construction. It is 100% design is funded by the state through safety funding.
Okay, so that's I was going to ask that for the next resolution that we're going to talk about. It also says new walkways, pedestrian walkways. Is this again something that we are adding in, new pedestrian walkways?
So as part of the road diet, what that is it'll be, we'll be decreasing the number of lanes, and there'll be a center turn lane because of the number of side swipes and rear end crashes. The lanes in their current state are not wide enough. So as we do the road diet, we're also going to add an 8-foot wide multimodal path, and I believe it's going to be on the north side of the road. So this is supposed to help with pedestrian traffic, and it'll be used for bicycles and walking as well. So that'll extend all the way from 3rd Street all the way up to Hudson Run, and eventually up through 31st Street.
Just to clarify, we're going to be taking lanes away from that. Just one lane and then shifting everything over, or is it 2 lanes on one side, 1 lane on another?
No, so I think the original plan right now would be to have one lane in each direction with a center turn lane, and that's based off of the safety study that was done, and based off the type of accidents, the number of accidents, this orientation of the lanes will reduce the number of accidents while also keeping traffic flow. There's a traffic study done along with the safety study.
Okay. And this is a similar question with the sewers. It says sewer improvements. What are we talking? Are we talking new sewer lines or just revamping the curbs for inlet or intake?
Yeah, most of that is all storm sewer, elevation, regrading, adjusting things, adding some new storm sewer in place, replacing existing things. But most of it has to do with the road surface, not so much what's under the road.
And one last thing, I know this is premature. Is this something what's the time frame are we looking at when this project will start? We're shooting for.
So construction on this project right now is scheduled for 2023.
All right. And we all, just to clarify, we do know that those are tentative dates. They can change.
Yeah, and there's a lot of planning that has to go along with this type of project.
Right. Would you be able to forward the contract to the council members for the ODOT through email? Do we have that in hand? Okay. I didn't have it in my packet here. I don't have
right now.
I don't.
I'll get it to you.
All right. Awesome. Thank you, Mr. Tracy. I don't have any other questions. Is there any questions from the committee members?
Yes, I have.
Mrs.
I just wanted to thank you. I just wanted to clarify this. You had mentioned earlier when you were talking that you turned this over, the city turned this over. This is an ODOT project from beginning to end. Is that correct?
Yes. When I mentioned that, it was the same. I'm referencing the last big project, which was the 5th Street Worcester Road. This is correct me if I'm wrong, Mr. Tracy, but this is an ODOT project.
So it's a city project, but it's ODOT-led, meaning ODOT will administer, they will do everything. They'll do the inspection, they'll administer all the paperwork. I mean, they're going to run it. We don't have to, it's kind of no touch on our end, besides, communication and being in touch with the contractors and everything, and the inspectors for ODOT during the project, making sure everything's getting done to our liking.
Thank you, Mr. Tracy, for verifying that.
Is there any other questions from committee? Mrs. Fry?
I have one question for you, Greg. You mentioned that there was going to be like a motor path, a walkway, so to speak, on the left-hand side of the road, but the left-hand side coming out of town or going into town?
It's the north side of the road is where it's proposed.
North side of the road.
So it'd be on the lake?
Yep.
Lake.
The West End Hardware.
Correct.
Right.
Is there any other questions from committee? Any questions from council members? All right. Mrs. Coburn?
Are they going to do something about the poles the big poles that are real close to the road?
That's a great question. Mr. Tracy?
Yeah, in this project there is, we will have to look at some right-of-way. ODOT will be looking at getting some right-of-way in that area to move some of those enormous power line poles away from the roadway.
All right. Finally, might get that bend addressed.
Councilman Greer, if I can point out,
Yes, sir.
kind of that explains the vastness of this project. It's a long stretch of roadway in town. It deals with everything that you mentioned with the traffic signals and the full depth paving and sewers and I think Councilwoman Joyce Coburn is talking about that major pole right when you come around the curve that sits right upon the street there. And that is a major pole that many lines to a lot of homes and businesses run into that. So that's going to be an undertaking of its own. So the severity or the width of this project is huge. We've done a great job of securing these funds, and I want to make sure that it's a complete project. So, we're all I'm really looking forward to 2023 so we can get that done or as soon as possible. But it's going to be a great project.
All right. Is there any other questions from council? Mr. Tracy, I do have one more question. What is the estimated cost of this project? What are we thinking in total?
The city of Barberton's portion will be about 1.7 million.
I'm sorry, 1.7?
Yep.
And that's out of issue 8?
Some of it is. Some of it will come from permissive funds as well. Ones that we would get reimbursed from the county.
Okay. All right. Is there any other questions from council members? Seeing none, do I have a motion to call for this piece of legislation? Motion made by Mrs. Fry.
Yes, I'll make a motion.
And seconded by Mrs. Angeloff. All in favor?
Aye.
All opposed? All right. Motion carries. The second request for legislation is draft ordinance titled Enter into Contract GPD. And this is a resolution authorizing the mayor to enter into contract with Laws Pyle, Schumer, Burns, and DeHaven, this is also known as GPD, to perform all design services related to the improvement of Worcester Road West from Hudson Run to 3rd Street Northwest, also known as Project ID 108240, and they are also asking for this to be called as an emergency. We tapped on this project already. This is GPD to do the design work for this, and as mentioned by Mr. Tracy, that the design work is 100% funded by the State Highway Safety Improvement Program with no local match. GPD was selected through a quality-based selection process as required by the Ohio Department of Transportation. Mr. Tracy, I just have just to confirm. Well, actually, you already confirmed it. GPD is this is being funded 100% by the State Highway Safety Improvement Program, and the city has no match for this program. GPD, it says GPD was selected through a quality-based selection process. Can you explain the process that the city went through to select GPD group for the design?
Yeah, so the process is a process required by ODOT. You have to follow their process. And what we did was an RFP would have went out in probably like 2018. And then it was graded internally, whatever the companies that came in by City of Barberton employees, and GPD was selected for that.
Okay, awesome. I don't have any questions other than can council I'm taking it that the design is really preliminary at this point or non-existent. That's what they're doing.
Correct.
Okay. When that is available, I'll just ask that council receive a copy of so we can have input. I know this is a big change in the area, so it'd be nice if I know there's plans and ideas, but it'd be nice if council has some input on maybe some design just to kind of, before it's approved through the city, just to provide a little bit of feedback, maybe also some feedback from residents, just a grace period.
ODOT requires public notification to all stakeholders, and there'll be different times throughout the process where the public will be included. Also, council would have the opportunity to comment on things as well.
Awesome, thank you. I don't have any other questions. Are there any questions for committee members? Any questions from council members? All right. Seeing no other questions, do I have a motion to call for this piece of legislation? Motion made by Mrs. Angeloff and seconded by Mrs. Fry. All in favor, say aye.
Aye.
All opposed? All right, motion carries. Third request for legislation is a draft ordinance titled 2021 Bids and Contract Years Requirement for Material and Services. This was referred to street, sidewalk, and lighting by utilities. We discussed this at our last meeting. However, I'll just recap on what it is. It's an ordinance authorizing the Director of Public Service for the Director of Public Safety to advertise for bids and or enter into contracts in 2021, covering the year's requirements for materials and services used in ordinary and daily operation of the municipal departments in the city of Barberton, and they are also declaring this as an emergency. This is just giving them permission to put bids out for general things across the board through the city, including concrete, gasoline bids, diesel bids, they have tires and automotive supplies, wastewater treatment supplies, water and water sludge removal, water distribution supplies, and water treatment supplies. Again, we talked about this in the last meeting, but is there any questions from committee members? Any questions from council? All right. Seeing no questions, do I have a motion to call for this piece of legislation? Motion made by Mrs. Angeloff and seconded by Mrs. Fry. All in favor say aye. 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 Sorry, you guys mute mic, sir.
Aye.
Aye.
All right, all opposed? No. And motion carries. Miscellaneous discussion. I don't have anything. Mr. Tracy, is there any updates regarding streets or lighting or anything around the city?
No, right now we're really finalizing things and getting things together to get off for estimates for the street program. Lighting, we're looking at some potential projects for the ball fields, more to come on that. But right now, everything's still in the planning stages.
All right. And do you have any update on the line painting that I reached out about? And to give context about this, I reached out to Mr. Tracy about repainting some lines on, I believe it was Worcester Road, because they were non-existent and people were complaining that road, they were getting cut off and run off the road in that one section. So just seeing if you had an update on that.
Yep, we have a quote in place. We're just kind of monitoring budget, and we're planning on taking some action along with the rest of our program here in the near future. All right, awesome. We may do those under emergency type of maintenance, but we're trying to see if we can hold off a little bit.
Okay. I have nothing. Is there anything from the committee members? Mrs. Angela?
I do have a question for Mr. Tracy, since we're talking about striping. About Robinson Avenue Bridge. I think I've been asking that for maybe 3-4 years to just stripe it, the crosswalk and that. You're smiling. So what are we doing? You're smiling, Mr. Tracy.
I will take a look at Robinson Avenue Bridge.
Thank you. Thank you.
Are there any other questions from the committee members? Any miscellaneous discussion from council? All right. Hearing none, do I have a motion to adjourn? Motion made by Mrs. Angeloff and seconded by Mrs. Fry. Street, Sidewalk, and Lighting is now adjourned at 6:25 p.m. Thank you.
Thank you very much. Next up is Environmental Health and Social Services, Mr. J.
Thank you, Mr. President. Environmental Health and Social Services meeting today at 6:25, virtual. All members present. Other council members also noted for Mrs. Price. And today we do have a draft ordinance that Mr. Thomas Heidig has requested. And Mr. Heidig, do you mind if you want to speak about that, please?
Thank you, Chairman. I wrote this resolution because Phase 1A and 1B are set to have the last round commence on February 8th. Just to give you guys some numbers from the Summit County Department of Public Health, updated January 13th in the 44203 area code, we've had 2,192 cases, which is only 3 off from the most in the entire county. A little background, Phase 1A was healthcare workers, residents and staff in nursing homes, people with developmental disabilities, the state-run homes for veterans and EMS workers. Phase 1B were by ages, starting with the higher ages and basically 65 and up. Congenital developmental onset medical disorders, employees of K through 12 schools. And that, like I said, the last round is going to be February 8th. Phase 2 has not been released by the governor yet. And as we've all seen by his directives and orders, he generally keeps that close to his chest and lets everybody know at the last second. We need to target slowing the spread, especially here in Barberton. Last year, Summit County declared race as a public health crisis. And if you look at the data that provided in the resolution from the CDC, minorities are very hard hit by this for reasons and factors listed within the resolution there. And the only way to truly slow a spread once Phase 2 happens, which I'm assuming by the governor would be starting to target general public, would be to target the hotbeds of infections. If this is truly a health crisis and truly affecting minorities, then we need to urge the county to be our voice. Now, I know the State Department of Health gives the marching orders, and they're only going to listen to us about as much as I listen to my cat down there eating. But the health department is our voice. We're under the jurisdiction of Summit County's health department. They need to really champion, especially here in Barberton. We have resources that others don't. We have a foundation. We even have a medical mobile facility in that purple RV that we can utilize. And it's time that we really start looking after our own. And if these hotbeds and infections continue, then we can have the resources to make sure that our people are safe. Now, last week, I spoke with Mayor Judge there, and he's with the Mayor's Association putting together some recommendations to the governor himself. And that's fantastic because we need all the voices we can to help us out with this. And if there's any questions, I hope that you'll look through the resolution and see the CDC reports and see the data and follow them. Thank you, Mr. Chair.
Thank you, Mr. Heidig. Ms. Angeloff?
Thank you, Chair. I do. When I have a couple of concerns that in the resolution it says that we have like 3,000 and Summit County has 119,000. I might not be quoting exactly the right stuff, but it seems as though my question is Summit County Council. Why didn't Summit County Council present this since it's Summit County Health Department? That's one question. And the second one is, according to CDC and the governor's office, the best way not to discriminate is to strictly use the age process. I'm not sure if that's, I mean, I'm sure they put a lot of thought into how they're going to do this. I don't see any discrimination when you strictly sign up the week of what your age is. And that would be for anybody and everybody that has that's in between that age. So, so that's where I'm coming from with this. I think it's a great idea. I just don't understand why Summit County Council didn't do this first. And that's my question, Mr. Heidi.
Thank you, Counselor. As to why Summit County Council didn't take this up first, only they can answer that. But Barberton being under their jurisdiction and not having a health department of their own, I don't see any problem with us taking the lead and hopefully spreading the word. As for the ages are addressed in phases 1A and 1B. As for the signing up, once the general public comes, I would think that if you look at with the data and with the risk factors involved, that it shows from the CDC, minorities are more likely to have multi-generational houses, different factors involving what they do for work. And if you, like I said, if you really want to try to slow a spread, you're going to have to make hard decisions. And it's a tough conversation to have because everybody knows that everybody's going to want this vaccine. But if you look at the logistics of it, I think you have to look at where the highest risk of infection rates and spreads could happen. Myself, I'm 40 years old, going on 41. I live alone. I don't have children, and I'm in somewhat decent health. There is no reason that I should be anywhere up in line over somebody that is in a minority section that has 3 generations, one of them at risk, a different one that's an adult and a child going to school. There's no way that I should be in line in front of them just because of the risk factors involved. And if you really, really, truly want to slow a spread, you got to start with where data is telling you it's hitting the hardest. So I hope that answers your question there, and I'm more than willing to answer any more.
Thank you, Mr. Heidick. Mr. Judge, Mayor Judge, since we're in the Health Commission, can you speak about this, please, if you don't mind? What do you think? What do you think we should do about this, and which path we should take?
Well, I think that the sentiment is definitely there, and I like that in this draft form. You discussed the inequalities of wealth because the social economic disparities are very important as well. And then you put race involved as well. That really narrows that field of who is at risk. So I think this is a good idea. As Councilman Heidick stated, it's up to the governor to create that priority list. And so we're working, I'm on a task force at the county level to talk about the distribution. So the governor gives the priority list. We do the distribution and communication and working with the hospital CEOs. The other thing that kind of goes along with this is, there's mistrust between minority groups and government. And so I want to make sure that we can get out there and get people vaccinated and make sure that all the information is being communicated effectively.
Thank you, sir.
Excuse me, Chair.
Yes, who was that?
Yes.
I'm sorry?
May I speak?
Oh, yes, I can't see you on the screen, but go ahead.
Oh, you can't?
Go
Okay,
ahead.
sorry.
You're good.
So I just wanted to, first of all, give everybody, if you are so inclined and have an extra 50 minutes, you can put headphones in and literally just listen to it. But on YouTube, there's a that actually touches at the heart of kind of what Mr. Heidick is saying about inequities in healthcare, and it's called "Start Here and Getting Real" about social determinants of health, and it's given by the talk is given by Dr. Donald Berwick. I can send that if anybody's interested. I can send you an email with the title of it. But I also just want to. I didn't see it in here, and I think it's something that is important for the mayor to take back to the county with his task force. I'm aware that several of the facilities that received vaccinations for phase 1A. And when people denied the vaccines were tossed. And this is so concerning to me because the faster we get the vaccine out, the faster we can build herd immunity. And, you know, I'm all for I do believe age is very important. I know that, you know, I think it's important to start there, but I also believe what Mr. Heidick's talking about as far as economic, there are a lot of determinants, and this TED Talk actually is very informative on that topic. But I just want to make sure that in the next phase of vaccinating, that we don't run into the same problem. They have a very short shelf life. They and we can't afford to throw, you know, if every facility throws 30 or 40 vaccines away, first of all, it's money, right? And then I just want to be sure that maybe there's a little more leniency with the plan so that we are not disposing of these vaccinations. So that's just my, you know, my take on what we have with the vaccinations right now and how it's being handled from the governor. So that's all I have.
I have not heard of any vaccinations being thrown away, but I will in Summit County or the state, but I'll look into that. I did see that on the national news, but I'll take a look at that and see if that's happening and if there's a reason for it. But yeah, I'll get back to you on that.
Well, there is a reason for it. The reason is that I mean, I know a facility that it happened at, and I'm not going to mention any names, but it's because it has a short shelf life, and I believe that you can only, you know, no facility wants to take responsibility for giving just anybody the vaccination, which I understand, but I think that we need guidance from the governor about how to handle that situation, and that's been discussed on national news as well. So I just think we need to, you know, we just need to add input if we can about that topic. And I mean, I understand why they don't completely. I just think we need to advocate for a better method so that that's not happening.
Mr. Chairman, I'd like to speak if I could. This is Elizabeth Doherty.
Yes, go ahead, ma'am.
There is no cost to American citizens for this vaccine. Mrs. Debevic, I don't know if that was one of your concerns. I heard you mention cost, but there is no cost. So the problem, as I see it, is there's many layers to this, and one of them is fear of even taking the vaccine. So there's a lot of fear in the minority community, from what I've been hearing and reading, about even accepting the vaccination. So that seems to me to be one of the ground level issues that need to be addressed by, and it is being addressed by minority pastors and politicians, and by paving the way and showing that they're willing to do it and that others should be willing to do it. And the mistrust is pretty deep and goes way back, multi-generations in this country, and I think that's a big issue. I don't know that it's an issue of inequality from a standpoint of offering the vaccine, because I agree that when you do it by age, the level of participation should be equal. Maybe it isn't. Maybe the issue is transportation to the sites to get the vaccine. That could be an issue that maybe could be addressed as well. But I from what I'm reading, it should not cost any American citizen money out of pocket, and it is available by age at this point and by comorbidity. So if you have other issues plus your age, it should put you ahead of others. And we're seeing a participation rate that isn't as high as we would like to see from what I've read. I think it's an educational piece.
Thank you, Mrs. Doherty. Just curiosity, has anybody in council has taken the vaccine yet, personally?
No, but excuse me, Chair, may I just respond?
I don't think that's something that that anybody's obligated to answer, Mr. Chair. That's a medical thing there. I apologize.
Oh, no worries.
Excuse me, Chair.
I haven't personally. Go ahead, Ms. Carla. Yes, ma'am.
Can you hear me?
Yes, I can barely hear you. I think Mr. Microphone's on.
Okay, let me turn my volume up once. Hold on. Wait, oops, wrong way.
There we go. That's a little bit better.
Can you hear me now?
Yes, ma'am.
Oh, whoa. It's really loud now. Okay. I just wanted to thank Mrs. Doherty for her weighing in. And I didn't necessarily mean, I absolutely did not mean that it was a cost to the patient, but it is a cost to someone, and we're all paying for it, right? Because we pay taxes. So for every vaccine that's tossed, it still costs money to produce. And I agree with you, Mrs. Doherty, completely about when I was mentioning inequality or inequity in healthcare, you're absolutely right that there's a huge distrust that goes back, hundreds of years with the medical community and minority groups. So for that reason, I would just encourage everybody to possibly watch this this video if you have time. And that's all I have.
Thank you. Anybody else from council?
Mr. Chair.
Mr. Griffin, is that you?
Yes, sir.
Yes, sir.
From my standpoint, from what I've been hearing and talking to people on both sides of the table, a lot of it is communications, because there's not communications out there that tells people you have to look for it, to apply phone numbers to call to get an appointment. A lot of the stuff is online. Just like today, I applied through Access Point right here in Barberton. I did it online. I got the information from the Kiwanis. Okay, and a lot of people don't really have connections like I do or other people we do, and they'll just sit back and wait. The word has to be out there to tell them how to apply, where to apply, and a lot of people, they'd rather do it on the phone. And right now, you can't hardly do too many things with a person. It's very rare to pick up a phone and talk to a live person. But one of our Kiwanis members, she got a hold to a live person with the Cleveland Clinic and got her father in there right away, but he's 90 some years old. Okay, but still they have to know that where to apply, how to apply. And that's one of the things that's really missing, is the communication parts of this.
Mrs. Colburn? Thank you, Mr. Griffin.
Yes, welcome.
One of the ladies that had someone get her in to the hospital to get it, when she called to go up to get it, they said they didn't have any to pass out after she'd gone through the whole process. Said that they didn't have any in Barberton to give. And that was today.
Okay.
Yeah, Councilman Jaber, I mentioned this the other week. There's a huge bottleneck or backlog somewhere, either at the federal level, at the private industry with logistics, or at the state level with not having enough vaccines. And this is true of the first dosage and the second. So, we've worked with all the hospital networks in the county and several mayors in the health department. And, the capacity is there to be able to do a certain number in each facility, but they have to have the vaccines. So we're looking into that, where's the logistical hang up at, and how can we receive more of those doses, because people are signing up, and when they sign up, they expect to get the vaccine. And then there's 28 days before you can get the second one. And then now we're going into phase 2. So, this is a major issue, and not just around here, but nationwide. And so we're all kind of working on this as we move forward. So
she's 89 and doesn't think she's very frustrated and says, I'm just not going to get it.
Prayers for her. Hopefully she gets it. I've had a couple constituents who are for it and who read about this in the Akron Beacon Journal. I did want to have one dirty email. One guy said, exact word, this is a political stunt for Mr. Heidick for his election coming up. I didn't reply to him yet. I was going to forward that to you, Mr. Heidick, so you can reply to him and give him more information. Besides that, I haven't had no negative feedback besides that one email. Any other questions or concerns about this?
Mr. Jabber? Mr. Chairman?
Nina, it's Mr. Jaber.
Jaber, I'm sorry.
Yes, that's okay. It's a year and a half into
I just wanted to piggyback of what Mr. Griffin said. I had a couple calls from constituents that are elderly and they don't have computers, and they wish that there would be a telephone number, like a helpline telephone number, or a number that they can call and actually talk to somebody on the phone. So, Mayor, if that would be something that you can take back, I think that would be a plus for, the elderly that don't have computers or don't want them or don't know how to use them. If they had a telephone that they can call, a telephone number. Thank you.
That's a very good idea, Mrs. Angela.
It's already available.
If I may, Mr. Chairman?
Yes, sir. Go ahead.
What Councilor Angeloff said there, Mr. Mayor, is it possible that we could get some sort of information and phone numbers into that section on our water bills?
Yeah, I'll make that call today after council and see what we can get up and running. It's very time consuming to track all of this. So I know that for one shot it takes a good 20 to 25 minutes because of all the information that they record, and then also to see if there's any side effects with the patient. So they want you to stay there. But I will look into this right after council and be back in touch with you very soon.
Mr. Chairman, Doherty here.
Yes, ma'am.
There are 800 numbers for the state, and then there's local numbers for Summit County Public Health that are readily available that I can forward to the mayor, and we can get that information out. They've been there.
Thank you. Like I said, this is all learning. I mean, we're all learning this. This is all new. Hopefully this epidemic is gone soon, but it's very, very scary. We got to take this serious and move forward with it.
Mr. Chair, Carla, Mrs. DeBevick is.
Go ahead.
I just wanted to make a suggestion kind of off of what Mr. Heidick said earlier. When Mr. Griffin was speaking, I was also thinking about, because the next phase is age geared, the older population that we have, and we have kind of a large older population here in the city of Barberton. A lot of them don't have the ability to use a computer and to register for updates or to receive updates. I wonder if that's something that we may be able to put together with the RV. I'm not sure if it has internet capability, but maybe go to have something where we could have a location in each park and assist anybody who may need assistance with figuring out how to get it and where to get it.
Yeah, I know that patients can also call their physician and get in that way. In terms of the RV, I've been working with Summit County Health, Access Point, and SUMA to make use of that, and they've signed up for it, and then at the last minute they'll cancel it. You may have seen at the beginning during the summer, SUMA had a kind of closed down their front parking lot by the emergency department and had a tent set up for testing at that time, and they were going to use it. And then more test kits became available. There's a dip in numbers. So we do have access to the mobile unit. They have expressed interest in using it moving forward. There is internet connection on there. So that's definitely something we can do. But anyone can call their physician and they should be able to get a test or a vaccine, that way as well. So we have a few options. You're muted, Mr. Jaber.
Technology, there we go. All right, anybody else have any concerns or want to discuss anything else or questions for Mr. Heidick? Mr. Greer, please.
Thank you, Chair. I just wanted to thank Mr. Heidick for putting this together. And I think the mobile RV is definitely something we should look into. We can sit here and to tap on kind of everybody's thing. Everybody's conversation. We can sit here and say that these numbers are available, but the issue that Mr. Griffin pointed out is the information's not being disseminated that it's available. So we actually have to be in front of them. And I think everybody's going to notice a big purple RV sitting at the park for a couple hours, or with a big sign outside that says, if you need help, then give help. So also, I just wanted to point out that I don't think we're ready for, on the second whereas of this, it says, at least on my papers, it says COVID-29. I don't think we're ready for that, but just wanted to point that out for when it goes into, when we actually...
I already sent changes to Renee.
Oh, okay, awesome. Thank you. And I don't have anything else, Chair. Thank you.
Thank you, sir. All right. So we're going to do a motion. Oh, Mr. Heidick, go ahead.
I just want to close this one with the military uses something called a risk assessment. And to anyone who thinks that this is just a ploy to get votes, when you do a risk assessment, you have to take a hard truth that no conversation wants to be had on that there is data showing a hard hit demographic, and the risk assessment as a military standpoint would tell you, you have to address that before you can address something else. Once again, my personal plan with the vaccination for me is there's over 26,000 residents of Barberton that are in line in front of me. I'm not sitting here trying to win over hearts and minds. What I'm trying to do is look at logistics that if you look at things objectively, you can't just put a blanket statement over anything like the governor and his restrictions and sanctions have done to businesses. You have to finally take a logistical step and say, where is the problem and how do we address it? This here is a problem and we can address it. We have tools, we have technology, we have everything we need in Barberton. We just need the county to go to bat for us because we are under their jurisdiction. That's all I have to say. Thank you.
Thank you, sir. All right. We have a motion to for this draft ordinance.
So moved.
All right. We got Mr. Griffin. All right. Mr. Griffin and Mr. Heidick. Mr. Heidick, can we call you Bebe now since it's official?
Mr. Heidick will do fine.
All right. And we'll do that. All right, and motion to adjourn.
With the vote.
Vote on it.
You have to vote.
Oh, vote.
Did you take a vote yet?
Yeah.
Go ahead. We'll vote on that.
Aye.
Aye.
Aye. Motion carried. All right. Yeah, motion to adjourn, please.
I'll make that motion.
I'll second.
All right. Seems like I'm having like a 3-second delay for some reason on this today. For some reason, I apologize for the technology. Give Spectrum a call tomorrow morning, see if we can work that out for next time. All right, we are adjourned at 6:55.
Thank you very much. Next up is Mrs. Coburn with a special meeting of city utilities.
Thank you, Mr. President. City Utilities is calling a special meeting. All members are present virtually. It's January 19th, 2021. This is the title. We have a draft ordinance titled 2021 Bids and Contracts for this year's requirements for materials and services. We did discuss this last week, but we didn't have the paperwork to call for this. We had referred this also to streets. This is asking for emergency legislation authorizing the Director of Public Services to advertise for bids and services used in the ordinary and daily operations of the municipal departments in the city of Barberton for 2021. Do we need any more discussion on this? We did discuss it last week.
I'll make a motion.
We are going to be putting emergency.
Excuse me, Joyce. This was referred to streets, correct?
Yeah, but we have to do this in utilities also, and we didn't do that. We referred to streets.
You're going to do it after the fact? Is that what we're doing? Because he already had us vote on.
We read it in streets.
The legislation.
Streets read it because they have to do it, and we have to do it also. Both.
Do you do it after the fact? It was referred to streets by you, by utilities.
I don't think it was supposed to be referred. I think it has to be done in both committees because it incorporates.
I believe it's joint.
Absolutely, it's a joint request.
Okay.
Yes, it's a joint request.
Sorry.
And we should have. Yeah, last week we should have had paperwork to vote on it. Remember I said, shouldn't we be voting? And we didn't have the paperwork to vote. So we're having a special meeting this week to vote on it, and so we can call for it tonight. Correct, Greg?
Yes.
Yeah, I'll look at rewording that next time so it's a little clearer. But yeah, I think it has to be voted on both committees.
We should have done that last week, and we didn't. So now we're doing it tonight. So do I have a motion to call for this tonight?
I will make a motion.
Mrs. DeBevick is first, and Carol Fry is second. All in favor?
Aye.
Aye. Motion carries. Do I have a motion to adjourn?
I'll make a motion. I'll make a motion. I'll second it.
Yeah.
Sorry, I was reading.
Okay. We are adjourned at 6:59.
Thank you very much. Next up is planning, annexation, and codes with Mrs. Angela.
Thank you, Mr. President. This is the Planning, Annexation, and Codes meeting, January 19th at 6:59 p.m. We're meeting virtually. All members of the committee are present, along with guests as noted on my sheet. Can everybody hear me?
Yes, ma'am.
Yes.
Okay. I don't want to be too loud. The topic of discussion, we have no legislation to request, but we do have a current legislation, Ordinance 01-2021, Zoning Map Amendment, Austin Drive. Last week, there was some questions that came up on different things for the builder. Now, this is just rezoning this, but I think there was some questions. I know Mrs. DeBevick had a question about the headlights and that type thing, pulling in and out of that allotment. I did reach out to the builder, and he did answer me kind of, sort of. He said that they are planning on adding more of those large evergreen trees, that they will plant them in between the existing trees. So that's one thing that they we're looking at. My request is to have possibly a guest parking lot, and they are taking that under consideration. And from what I heard from Mr. Tracy, that they're looking at maybe having the streets a little bit wider than what they originally had said. So I just wanted to answer those questions that was brought to my attention. I have nothing else on that rezoning. Anybody from the committee have anything? No? Anybody from council have anything? No? Okay.
Mr. Heidig does.
Oh, I'm sorry. I didn't see your hand up there. It was off the screen.
That's
Go ahead, Mr. Heidig.
the opposite way there. I just wanted to make it known that I have received 0 opposition thus far for rezoning.
Thank you. I haven't received anything. I've talked to a couple people about it, and they're almost excited that they see another allotment going up there on that piece of land that's been vacant for a number of years. So there is a place, they only have, it's in Copley, Ryan Townhomes, and they only have up the model home. So I'm planning to take a trip out there just so I can take a look at 3 stories, see how big that is. So I'll report back next week if I get out there. Any other comments? No? Okay, thank you. Second thing on the agenda is an appointment to the Planning Commission. It's Mrs. Taylor Thompson, and I hope everybody had a chance to read her resume and that. I only have one comment, and that was number 3 on her resume. I thought that was interesting, that she's really interested in this town that she lives in and raising her family. Do I have any comments from anybody on my committee? Anybody from council? Okay, do I have a motion to call for this appointment?
Mrs. Angeloff, I'll make a motion to call for this.
Mr. Greer, do I have a second?
I'll second it.
Joyce Colburn, all in favor?
Aye.
Aye.
Okay, motion carried. And I have no miscellaneous. Does anybody on the committee have any miscellaneous to address? Anybody on council have anything to address? Okay, do I have a motion to adjourn?
I'll make that motion.
Joyce Colburn, second.
I'll second.
Mr. Greer, and we are adjourned at 7:03 p.m. Thank you.
Thank you. Okay, next is Finance and Personnel, Mrs. Fry.
Thank you, Mr. President. The Finance and Personnel Committee meeting will begin at 7:04 p.m. It is January 19th, Tuesday. We are all at this meeting remotely. All members of the committee are present, as well as all council members and guests, as noted on my meeting agenda. We have no requests for legislation this evening, nor do we have any appointments. Therefore, does anyone have anything of a miscellaneous nature they'd like to discuss? Mrs. DeBevick?
Thank you. Thanks, Chair. I was just wondering, this is maybe more for the mayor, or I don't know if we have someone from IT here, but on December 29th, the mayor sent an email regarding the fact that the iPads were in, and that he didn't believe they would be up and running that week because of New Year's. Eve, but it should be right after that. And I was just wondering if we had an update on that.
I'm actually meeting with IT tomorrow about this. About the same time we got our iPads in, or whatever device are being used in the building department for our building inspectors. So I know they were getting everything not only loaded on there and up and running, but also so everything can connect to the network and have the security and all that stuff. So, and on top of that, everything that's been going on with council and technology, you still have other computer and devices throughout the city that are being fixed or updated. So, but I actually have a meeting tomorrow with IT about it. So I'll have more of an update then.
Okay, thank you. I just was asking because it seemed the way the email was worded that it would be sooner rather than later. Now, I do have a question. Well, maybe I can just ask you later. It's just about the server being loaded. We wouldn't actually, right now, we aren't actually in the city building. So I was just curious. It's fine. I just wanted to ask where we stood. That's all I have, Chair.
Thank you. Does anyone else have any comments or questions? Hearing none, do I have a motion to adjourn?
I'll make that motion.
Motion made by Mr. Medges and seconded by Mrs. Angeloff. And we are adjourned at 7:07 p.m.
Thank you very much. Okay, we'll go right into our committee meeting, unless anybody needs a break. Okay. Okay, this is a committee meeting, committee of the whole meeting of the Barberton City Council. Today is Tuesday, January 19th, 2021. I call this meeting together at 7:07 p.m. Okay, please stand for the Pledge of Allegiance. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Okay. Okay, Council Rule 103 states that regular and committee of the whole meetings shall start at 7:30. Since we are starting earlier than this, we will need to invoke Council Rule 702. Mrs. DeBevick?
Thank you, Mr. President. I would like to make a motion that we invoke Council Rule 702 to suspend Council Rule 103.
Thank you. And Mr. Heidick?
Thank you, Mr. President. I will second that motion to invoke 702 to suspend 103.
Thank you. Motion was made by Mrs. DeBevick and second by Mr. Heidick to invoke Council Rule 702 to suspend Council Rule 103. Are there any remarks? All those in favor signify by saying aye.
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 Any opposed? Okay. Citizens addressing council. We have one, and Ms. Price is going to read that.
Okay. We have a certificate from the U.S. Census recognizing the Barberton City Council as an invaluable member of the 2020 Census Community Partnership and Engagement Program. We appreciate the efforts you made in making the partnership program a success and helping achieve a successful 2020 census. And it's signed by Dr. Stephen Dillingham, Director of the United States Census Bureau.
Are there any others? Okay, hearing nothing, we will go right into our committee reports. And first off is Mrs. Angeloff with Planning, Annexation, and Codes.
Thank you, Mr. President. Planning, Annexation, and Codes met this evening at 6:59. All members are present, along with council members and guests as noted. Topics of discussion, we have no legislation request, but we do have a current legislation, Ordinance 01-2021, zoning map amendment, Austin Drive. We had a first reading on that January 11th, and the next reading will be next week. Second, we had an appointment to the Planning Commission, Mrs. Taylor Thompson. That motion was carried, and we adjourned at 7:03. And with that, I pass.
Thank you very much. Next up is Mr. Greer with Streets, Sidewalks, and Lighting.
Thank you, Mr. President. Street, Sidewalk, and Lighting met today, January 19th, 2021 at 6:06 p.m. and we were virtual. All committee members were present, and other members noted, as well as council members. We had 3 requests for legislation today. First request for legislation was a draft ordinance titled Enter into Contract with ODOT, and they are asking for emergency wording on this. This contract for ODOT, well, this contract is in regards to it. This is a Barberton street project, but ODOT is going to be handling the project. The street project is Wooster Road from 3rd Street to Hudson Run. This is a stretch of road from the post office to Durbin's or vice versa. This project will include a full depth pavement reconstruction, new traffic signals, possibly new. They're looking at signals in other areas too as well. This will include pedestrian walkways, sewer improvements. This is going to be a very large project, and they're actually going to be cutting the lanes down and widening the lanes, as well as possibly moving some telephone poles around. The pedestrian walkway is going to be hoping to be on the north side of Wooster Road. That's the side of West End Hardware, as well as if you're farther down, it'd be on the subway side, post office side. And that's going to be a pedestrian walkway, bike lane idea that's going on there. There's going to be a center lane for turning and 1 lane in each direction of travel. The project, again, is a Barberton project, but ODOT is going to be handling the project for us. The estimated cost to Barberton, since this is such a large project, is approximately $1.7 million. The funds are going to be coming from Issue 8 and permissive tax funds. The expected project date is in 2023. This is a matching grant at 80/20 with the AMATs. The second, we voted on that and that passed. The second draft ordinance piece of legislation is enter into contract with GPD Group. This project is in relation to the ODOT project that just discussed, project ID number 108240. This is requesting the mayor to enter into contract with GPD to handle the design phase of the Wooster Road project. GPD is 100% funded by the State Highway Safety Improvement Program and has no cost to the city for this portion. GPD was selected through a quality-based selection process, which Mr. Tracy explained that it was done through a request for proposal a couple years back, at least a year ago, and they came out as the best bid for the project. And that passed to go to the floor. The next request for legislation was referred to Street, Sidewalk, and Lighting from Utilities. The draft ordinance is titled 2021 Bids and Contracts Years Requirement for Material and Services. This ordinance, again, was referred to Streets from Utilities and is requesting authorization to begin the bid process for commonly used services throughout the city. Miscellaneous discussion. I brought up line straping update just in regards to a request from a couple constituents on Worcester Road, and Mrs. Angeloff brought up Robinson Avenue Bridge again, and Mr. Tracy is going to be looking into that. There was nothing else, and we adjourned at 6:25 p.m. With that, Mr. President, I pass.
Thank you. Next up is Mrs. Coburn with City Utilities.
Thank you, Mr. President. City Utilities met last week and again this week, January 19th, to discuss the 2021 bids and contract years requirement for materials and services. We voted on bringing that out next week. We discussed it in depth last week, and we also forwarded it to Streets, and Mr. Greer explained it very well as to what it's for. It's for the everyday operations of the departments. We passed it, brought it to bring it out, and with that, I pass.
Thank you very much. Next up is Mrs. DeBevick with Public Welfare and Safety.
Thank you, Mr. President. Public Welfare and Safety met on January 11th, 2021 at 6:18 virtually. We had no request for legislation. We did have miscellaneous discussion, a question regarding traffic on Robinson near Elementary East and whether or not it would be possible for that light to go blinking during off hours. And Mr. Heidick, I believe Mr. Heidick posed that question. I'm not certain if he received an answer yet or not, so I will need to follow up on that.
Director Doherty answered it, yes.
Okay, thank you. And with that, Public Welfare and Safety will pass.
Okay, thank you very much. Next up is Rules, Marketing, and Development, Mr. Griffin.
Thank you, Mr. President. Rules, Marketing, and Development met on January 11th. All members present and other guests as noted. We met virtual. We had no requests for legislation to call for. We also had no miscellaneous discussion as well. With that, we adjourned. With that, I pass, sir.
Thank you very much. Next up is Mr. Jaber with Environmental Health and Social Services.
Thank you, Mr. President. Environmental Health and Social Services met at 6:25 virtual, January 19th, 2021. All members present and others also noted. We had one request. It was a draft ordinance. Ordinance was from Mr. Thomas Heidick. This is the Summit County Board Department of Public Health for Phase 2. We had a good discussion about it, and the motion did pass. And with that, we adjourned at 6:55. With that, I pass, Mr. President. Thank you.
Thank you. Next up is City Properties, Parks, and Recreation with Mr. Heidick.
Thank you, Mr. President. City Properties, Parks, and Recreation met last Monday, January 11th, 2021, 6 p.m. virtual. All members were present. Everybody noted. We had no request for legislation. Our miscellaneous discussion, we welcomed our new Parks Director, Director Patterson, and we also had discussion on the project involving a skate park, hopefully in the future. I know Councilor Jaber and the Mayor, Director Hunt, all met the other day. And Mayor, if you're having a mayor's report later, if you could just kind of give a little update on what you talked about. That was it, and we adjourned at 6:18. With that, I pass.
Thank you. Next up is Finance and Personnel and Mrs. Fry.
Thank you, Mr. President. Finance and Personnel Committee met tonight. The meeting began at 7:04. It is Tuesday, January the 19th. The meeting was held virtually. All members were present, as well as all members of council and guests as noted. We had no requests for legislation this evening. We had no appointments. We had one comment during the miscellaneous discussion, and that was from Mrs. DeBevick, and she was asking what the status of our iPads are. And Mayor Judge gave an explanation. And with that, Finance and Personnel will pass. Thank you.
Thank you. Mayor's report.
Hi, thank you, Mr. President. First, in terms of the skate park, yes, we met last week. Also included Councilman Griffin, Parks Commission member Denny Little, and Brett Fogel from the foundation, and kind of went over a tentative plan moving forward. If we settle on Decker Park, this is a project that started, 6+ years ago. And so looking at what utilities are under the park land, and looking at the depth of the skate plaza, looking at the size, the dimensions, lighting and drainage and all those things that kind of go with any type of development would be the next phase. And looking at the plans that we have that were put together a few years ago and updating those. So we've got a lot of work to do, so it won't happen overnight, but hopefully we can get something going here pretty soon. Moving forward, still collecting non-perishable items for the Salvation Army and Backham through the end of this month. And then we'll do it again in July for Christmas in July. So a lot of good participation. So we'll run this through the end of the month. Still conducting business meetings with businesses in town, discussing their needs, looking at some expansions, looking at some increased jobs, and doing everything we can to help them out. So I actually had 2 important meetings yesterday. City building was closed, but we had 2 very important meetings yesterday that were productive. The 2021 budget had 6 department meetings last week, have several scheduled for this week. I know we want to get you a budget to council as soon as possible. And so I anticipate getting something to finance later this week, but more likely next week, and then get something to council by the end of next week. But want to move as quickly as possible, but still have some meetings I have to set up and go through. In terms of COVID, this has obviously been a hot button issue for the better part of a year now. So, in terms of everything that we're talking about, there are new strains of COVID, and they're surfacing and mutating, and a lot of discussion and research is going into these throughout the world. So more information coming soon on those. In terms of cases for the state of Ohio, Summit County, and even our zip code, we're seeing a little bit of a dip just over the last week. So we look at numbers on a daily basis, but I kind of report to them, to department heads on a weekly basis. So a little bit of a dip. This past week was one of the first few weeks that the state of Ohio has had less than 50,000 cases in a week. So we have experienced more than 50,000 new cases in 8 out of the last 10 weeks. But this last week was one that we did not. A lot of stats that I keep on cases and deaths and demographics and things of that nature. When we go to the vaccine, as mentioned, local health departments will handle communication, distribution, and management. And we've got a task force put together for the distribution part of the vaccine. The big issue is having enough vaccine, and this is a nationwide issue. There's 2 drug companies now, Moderna and Pfizer, who are creating this and have the approval. But other drug companies are seeking approval with their vaccine. For example, one is Johnson & Johnson. So once that approval is provided, more vaccines should start to flow in. I believe the dates were given for the governor's vaccination timeline. Today started anyone 80 and older. January 25th, anyone 75 years and older. February 1st, anyone 70 and older. And then it continues down in increments of 5 years. So still a lot of work to do on that front. Internally, HR continues to put information out and update everyone on the rules and different things that mandates, and making sure that we're providing for our employees. In terms of kind of the future of COVID and stimulus, a new administration is coming in, and the proposal right now is about a $1.9 trillion stimulus proposal. It does provide funding for small businesses. It does provide funding for rent and mortgage assistance, utility bill assistance, and additional money for individual payments, among other things. Obviously, this has to go through both the House and the Senate, so that could change quite a bit. So everyone's just trying to get through this week with the inauguration and everything, and then get down to business as soon as possible with the stimulus proposal. A few questions from tonight, and I'll reach out to Summit County Health Director Donna Skoda and get you answers, and I'll email you guys as soon as I get that information. I am the Vice President of the Mayor's Association of Portage, Stark, and Summit County, and as Councilman Heidick had mentioned, we did put together a letter sent to the governor talking about the priority list and moving police up to getting the vaccine faster, because they were pushed out of the first responders category. But the Northeast Ohio Mayor's Association, which I'm a member of as well, has also drafted a letter and sent that on to the governor as well. So, I'd hate to be in his shoes, but there's a lot of inequities when it comes to dispersing something this major. And you may have seen on the news where, Starbucks and Amazon and some other companies are getting involved because that's what they do. They do logistics, they do supply chain. Governors govern. County executives, mayors, they govern. So places like Starbucks and Amazon and a few others have stepped up to the plate to say, hey, let's put together a real plan to distribute the vaccine and be more effective in it. So more will come very soon. But every day information is changing on this, whether it's the CDC with quarantine days and timelines. The governor has altered the school quarantine guidance, talking to hospitals and long-term care facilities and health departments, and just a lot of information flowing back and forth and changes. So I think everyone's kind of waiting for some direction from the federal government. Again, that'll come in the next few days or weeks. And then we'll just keep plugging away and doing what we're doing. So outside of COVID, we continue to function and move forward. And a lot of businesses are looking to expand. And so we're going through all those motions and hopefully have some good news to share with everyone on some of these developments. That's all I have, Mr. President.
Thank you, Mr. Mayor. Anything from council members or department heads? Mrs. Fry.
Yes, sir. Oh, excuse me.
I just wanted to apologize to Mrs. Coburn about the misunderstanding about that piece of legislation, but it's the same piece of legislation. And normally when it's referred, it's already been voted on before it's referred to the final committee. So I'm sorry about that.
No problem. Thank you.
Anything else, Mrs. Fry?
No.
Okay,
that was it.
Thank you. Okay, Mr. Griffin.
Okay, thank you, Mr. President. In recognition of Martin Luther King Jr. Day, the local chapter of the NAACP is pleased to distribute masks here in Barberton. I was able to get 360 masks for Barberton. The Summit County got 3,000, and all this was from the Ford Motor Company. Connie Hightower, the lady that ran for judge and lost, she contacted me and another lady named Susan Belt with Forward United NEO, which I don't know that it's some kind of indivisible group. So this Saturday between 1 and 3, I'm going to distribute masks at 3 locations. One place will be Rockies on Norton Avenue and the library, and then I'll be at Elson Park. And I also got hand sanitizers from Captain Ashley. She donated some hand sanitizer. So I'll be able to give a mask and a hand sanitizer for individuals that show up. And they don't have to get out their car, and supplies are limited. And, you know, I think we still have to go with the as long as we can. So, if anybody want to help or donate anything, just let me know. And we'll put it out there. Thank you.
Mr. Shorter, I have a question, please. When are you going to be at Elson Park, Mr. Shorter?
1 to 3. This Saturday, the 23rd.
Okay, thank you.
Saturday,
Thank you for doing that, Mr. Griffin.
You're welcome.
Thanks for stepping up, Mr. Griffin. Thank you.
Anyone else? Hearing nothing else, this meeting is adjourned at 7:31. Thank you.